So let's quickly go through Trichella spiralis. Now, this is a worm and it's actually the smallest. When you're discussing worms, you are going to split them into the flatworms or the platy helminths and the roundworms. The roundworms will further be split. Okay, you further split them. So this Trichinella is actually the smallest nematode. It's a roundworm. So Trichinella spiralis is also known as trichina worm. Trichos just means hair. Spiralis means it's coiled. So it was first observed in muscle of the patient who was James Paget. So it is a common parasite specifically of pig and zoonotic disease, meaning that you actually get it from pigs and you also can get it from animals that are kept. That is zoonosis infections that you can get from animals to man. So the habitat, where do you find Trichinella spiralis? The adult worm is going to be found in the mucosa of the small intestines, while the larva is going to be found in striated muscles. And these are skeletal muscles and cardiac muscles, but specifically the skeletal ones. So as we've said, the habitat, the adult worm is going to be in the mucosa of the small intestine, specifically the duodenum and the jejunum. And then the encysted larva, the larva that is in a cyst, is going to be in striated muscle of host. There is no free living stage. The stage is just found in the stages of Trichinella is they are only found in the host. When you look at the morphology of this worm, the female is bigger than the male, and the tail for the male, the tail end contains a pair of pear-shaped clasping conical papilla, which are called as claspers. Okay, and the male is actually short-lived. The female also, the lifespan is very short, but it is viviparous. Okay, it is viviparous. So it is going to be able to, the first stage of larva is going to be released in the small intestines. So when you're talking about worms, you have got those that are viviparous, you have got those that are oviparous. So some of the worms will actually lay down eggs, others will just remove the larva. Okay, for example, this same one, they don't lay eggs, they will just remove the larva. Okay, that's the meaning of viviparous. The oviparous, these are the ones that lay eggs, and then from the eggs you are going to have the worm coming out. So the larva is going to be infective, and the encysted larva, the one that is in a cyst, is present only in striated skeletal muscles, and it is tightly coiled inside the cyst. That's the meaning of encysted. So the larva is present within a cyst. That's the encysted larva. We also have what we call the excysted. This is when the larva is out of the cyst. All right. So the adult worm is a small white worm, just visible to naked eye. And it's actually the smallest nematode infecting human. The anterior half of the body, like the front part, is thin and pointed, well adapted for burrowing. To burrow is like to dig into the mucosa of the epithelium. So you can see the way it is in front, thin and pointed, so that you can be able to dig into the small intestines. Okay, so we already compared the males and the females. The male dies soon after fertilizing the female. The female has got a length that is twice the male, and the female is viviparous. Okay, it will discharge the larva instead of the egg. It's not oviparous. and the female dies after 4 weeks to 4 months after it gets to grow. The larva, this is the one you can see here, the encysted larva. Okay, the larva will become encysted, or it will be hidden in a cyst in striated muscle, and the larva in the cyst is coiled. That's why it is called spiralis, as you can see here. Now, the cyst is the tissue reaction around the encapsulated larva. That this structure that you can see around the larva, that's what we call the cyst. And it develops preferentially in active muscle like the diaphragm, jaw muscles, the biceps, the neck, the lower back, which are poor in glycogen and hypoxic environment. Okay, and they are more abundant near the site of attachment of muscle to tendon and bone, and will be able to lie longitudinally in the muscle tissue. They will be straight as the muscles go, like that. The life cycle, they have got one host. It can either be man, the pig, or the rat. So man is usually the dead end host. So if they come here, they've come to kill or they've come to stay. Okay. And then the pig is the optimum host. This is where you are likely to get it. This is where they like having their life cycle. So man will be able to acquire infection by ingestion of raw or inadequately cooked pork containing the viable encysted larva if the larva has not been killed yet. So as we said, the optimum host is the pig, is favorable or is the principal host, and then the alternative host can be man. Okay, we also said it can be rat. Man is the dead end of the parasite, as a cyst in human muscles are unlikely to be eaten by another host. So the cyst will still be there, because if the cyst is in the man, you are likely going to just have it. It will not go anywhere. Okay, so that's called the dead host. The mode of transmission, man will acquire the infection by raw, undercooked pork or inadequately processed sausage or other meat products containing the larva. Okay, so man is going to eat meat is going to be eaten without adequate cooking. The cysts are going to be digested by the gastric juice, and the viable larva are going to be released in the stomach, the duodenum, and the jejunum. The larva immediately will be able to penetrate the mucosa epithelium. All right, and then they are going to molt 4 times. They are going to divide 4 times and then develop into the adult, which is on the second day of infection, and then they become sexually active within 6 days. The male is going to die after fertilization, fertilizing the female, but the fertilized female starts releasing mortal larva by the 6th day of infection. You can see there are no eggs. The larva will continue to discharge during the lifespan, 4 weeks to 4 months. Larva will enter intestinal, lymphatics, or mesenteric venues and are transported in circulation to various parts. And then they get deposited in muscles. Okay, that will be like somewhere in the second week, the central nervous system, and also other sites. And so the larva dies in other sites except skeletal muscle, where it is going to grow and develop 3 to 4 weeks later. So within 20 days, the larva will become encysted in muscle. It will be surrounded by a cyst. Okay, so a muscle that is containing Trichella spiralis is called a nest cell. Muscle with the worm is a nest cell. The encysted larva lies parallel to the muscle, as we said earlier. Okay, this is again the process as we've described it. So the pathogenesis, the disease caused by Trichella spiralis is trichinellosis, trichinellosis, or trichinosis. It is usually asymptomatic, or you can have acute fetal illness. The clinical features, the stage of you are going to have the stage of intestinal invasion. What are the signs that you are going to see if the intestine have been invaded? Gastrointestinal disturbance, there will be malaise. Someone just feels not okay. They just feel sick, but they can't tell what's wrong. There will be nausea, vomiting, diarrhea, and abdominal pain. And then the stage of muscle invasion or larva migration, there will be fever, myalgia, this is pain of the muscles, periorbital edema, weakness of infected muscle, and allergic manifestations. The stage of incystation, when the cyst is forming around the larva, which occurs in striated muscle, all symptoms will be able to subside and the larva will calcify, like it gets stuck in the muscle. So the calcified larva can be seen grossly in exposed muscle. So it causes muscle pain. Okay, as you can see, the larva will be seen. It becomes calcified, like it's now engulfed, it's part of you. Okay. So how can you diagnose infection caused by Trichinella? You can do parasitology, you can demonstrate larva in muscle from a biopsy, can detect adult worm and larva in a direct stool. Okay. And then you can also look at blood, serological. You can do the bentonite flocculation test, latex agglutination ELISA. In other words, basically for serology, you can basically see the antigen to the worm. And then skin test like the Batchman antigen, okay, also antigen, intradermal injection of larva antigen. So if you inject the larva antigen, because you have the larva, more like the body is producing antibodies against it, so you're going to be able to see erythema. Like the area where you've injected antigen will be red. Okay. And then on radiography, you can do X-ray, and then you also see eosinophils increasing, eosinophilia. Okay, so basically for diagnosis, you have got the direct methods and the indirect method. For the direct methods to be able to see the worm, you can look at the worm in the muscle biopsies, to examination, and the xeno diagnosis. Indirect, you can take a history, you do, and then just by looking at the physical features in history that someone presents with, blood examination for antigens and such. Okay, serology, radiography, PCR, and the Batchman intradermal test. So this one is just explaining each one of the methods. For the treatment, if the cases are mild, you just do supportive treatment like bed rest. You also give some painkillers and also some drugs to help lower the fever, because we said that when the cyst is in the larva is in the muscle, it can cause also fever. For moderate cases, you give albendazole or mebendazole. And then for severe cases, you can also add the glucocorticoids like prednisolone and to albendazole or mebendazole. So basically, the drug of choice is albendazole or mebendazole. If the case is severe, also add the glucocorticoids. So prophylaxis, what can you do to prevent infection by Trichella spiralis? Proper cooking of pork and other meats which are likely infected. So the most effective method is to stop the practice of feeding pigs with raw garbage, because when you feed them with this raw garbage, you actually get to feed on the worm. Okay, also extermination of rats from pig farms, because they also spread infection, because these rats are carrying, let's say, the worm, and then the pigs eat them and such. Okay, actually the rats themselves will just spread the infection, because normally the pigs, these ones eat just things that you've left like the veggies. And then smoking, sorting, or drying the meat does not destroy the infective stage. Prolonged freezing decontaminates the meat. So if you freeze for long, okay. So as we said, the treatment is via albendazole, mebendazole, thiobendazole, prevention, proper cooking of pork, avoid practice of feeding pigs with raw cabbage, inspection of slaughtered pigs. In case you see in the muscles, you'll be able to see the worms. So we have got some questions. Trichella spiralis is commonly known as, so it's a pork worm. Trichinosis is caused by a bacterial infection, viral infection, parasitic infection, fungal. So it's a parasitic. Remember, worms are parasites. Infective stage of Trichella spiralis for human is, it's the larva that has been encysted in muscle tissue. That's the one that infects human. Which of the following is a common source of Trichella spiralis infection in humans? So the common source is undercooked pork. the hallmark sign of the parental phase of trichinosis. Okay, the parental, like if trichinella ends up now into the body, the hallmark sign that you'll be able to see, swelling around the eye, periorbital edema. Adult Trichinella spiralis worms are found in which location? Remember, the adult is in the intestines while the larva is in the muscle. The diagnosis of Trichinella spiralis infection is made often by stool examination for eggs, blood test for antibody, muscle biopsy for larva. Please take note that in stool you want to look for eggs. Blood test is antibodies. Muscle is for the larva. So you don't go to the muscle to look for eggs, no. Okay, so all of the above is correct. Which of the following is a common symptom of trichinosis? Fever, muscle pain, swelling around the eye, which is periorbital edema. All these are signs. What is the preferred treatment for neurotrichinosis or trichinosis with neurological involvement? Remember, we said that if the condition is severe, you give albendazole or mebendazole with corticosteroids. Trichinella spiralis is a So it's a roundworm, as we said. Roundworms, we call them nematodes. For the flatworms, you divide them into the cystodes and trematodes. Okay, cystodes are the tapeworms, trematodes are the flukes. These ones are flatworms or platyhelminths. Which of the following is the smallest in size? Trichina spiralis, Trichuris trichuria, Strongylus stacularis, and Xylostoma duodenale. So Trichinella is the smallest. What is the most common way humans contract Trichinella spiralis infection? It's eating undercooked or raw meat, especially pork. Which of the following is the infective stage of Trichinella? As we said, it's the encystic larva in muscle. Which of the following is a common symptom of trichinellosis? Jaundice, muscle pain and weakness, fever and headache. So all these are signs, right? Where do Trichinella spiralis larvae insist in the host? It's in the muscle tissue. Which of the following is not a typical host for Trichinella spiralis? So chickens are usually not, though we said there's some form of zoonosis, but typically chickens are not. But you can find in other animals like human, pigs, rats. What is the role of the encysted larva in the muscle tissue? Okay, the encysted larva in the muscle tissue, that is the stage that infects a new host. It's the infective stage. Which of the following is not a characteristic of the adult Trichinella spiralis? They are viviparous, they are hermaphroditic, they are relatively small in size, they are found in small intestine. Now, they are not hermaphroditic because the male and the female are separate. This word means that the same worm has got female sex organs and male sex organs, and that's not true. Which of the following is a treatment option for trichinosis? And fungal medication, antibiotic, anti-homeopathic drugs like albendazole and mebendazole, antiviral. So these are basically anti-homeopathic or drugs against worms. What is the significance of the nest cell in the life cycle of Trichinella? Remember, we said that a nest cell is a muscle tissue that has got a parasite within it. Okay, so basically, that is it on Trichinella spiralis.